I'm going to begin today my comments by reinforcing and repeating and acknowledging that we are gathering on the land of Treaty 6. UNA's offices are located on the territories of Treaty 6 in Edmonton and Treaty 7. And we are grateful to the diverse Indigenous peoples whose ancestors' footsteps have marked these territories for centuries. We are thankful for their stewardship of this land on which we have the privilege of living, working, and raising our families. We also acknowledge this as the Métis homeland and the home of the largest communities of Inuit people south of the 60th parallel. Okay. It has been 3 years since we actually gathered for an annual general meeting. Our last annual general meeting was, of course, in October 2019, and our last in-person gathering was the provincial demand-setting meeting in November of 2019. Since then, we've experienced 3 horrible years, and I can't think of a more descriptive adjective. We, all of us here, have shared a once-in-a-century event. At least we hope a pandemic is a once-in-a-century event. When we last gathered, our workplaces, particularly staffing, was being ravaged by operational best practices. And despite the reality of increasing workloads, the intentional transformation of the workforce had already resulted in positions left unfilled and disappearing entirely. Shortly after that demand-setting meeting in 2019, and on the eve of entering bargaining, we were informed that 500 full-time equivalents would be eliminated. That's like 750 positions. When we actually exchanged bargaining proposals in January 2020, we were confronted with the most massive attack on the rights and financial elements of our collective agreement in the history of United Nurses of Alberta. The initial assault didn't include a wage rollback, but unbelievably, that would come later when our entire society, we and our entire society, was deep in the grip of COVID-19. And when the public recognized essential workers, such as us, as heroes, our government insisted a shortage did not exist and our contributions were of even less value for the people of Alberta. Lonnie, if you're here, heroes to zeros. Each of us has unique memories of what transpired after March 11, 2020. When the World Health Organization declared COVID-19 was in fact a pandemic. Fear was undoubtedly the first reaction. Fear for our families, fear for our patients, fear for ourselves, and some of you may even recall the public fear of some healthcare workers. You have witnessed and experienced suffering and anguish of unprecedented proportions as wave after wave brought disruption, reassignments, and deaths. And also, with it came anger and frustration. It wasn't until January of 2022 that we achieved a negotiated settlement. One which, thanks to the tenacity and strength of our collective will, resulted in a new contract that, although it did not truly reflect the level of recognition and appreciation of our services. It did not take us backwards. We did move forwards, strong together. But the toll on our profession and the destruction of our workplaces, sadly, is not over, and neither is COVID. How many of our colleagues, your colleagues, have succumbed to illness, physical and mental exhaustion, compassion and moral distress, and professional burnout? Our new reality is a global shortage of nurses and other healthcare workers. Our new reality is of agency nurses in ICUs and emergency departments in tertiary hospitals in this province. What is the new reality? Service disruptions and closures. And all the while, the pressures to implement Connect Care, whatever the cost. And at a time when we most need professional cohesion and advocacy, I'm sad to say that I believe we are more divided than ever in certain ways. This was a significant year of change for registered nurses. I know that was not for registered psychiatric nurses, but it was a big change for registered nurses. The separation, the final separation of the college and the association, it means that we are no longer part of an Alberta professional association. We are no longer part of the Canadian Nurses Association, nor the International Council of Nurses, unless we independently pay to do so. At this time, I have to say that I believe our greatest single voice for nurses in Canada is the Canadian Federation of Nurses Unions, that's CFNU, of which we are proud members. Increasingly, the role of professional advocacy falls to the union, and that's the case here and in other provinces as well. And because that responsibility has fallen to the union is why we have bolstered our professional responsibility resources as an organization. The reality of the workplace is tragically, and they're heartbreaking, tragically reflected in professional responsibility concerns submitted by our members. Most often, the number of professional responsibility concerns in a single week is 2 to 3 times the number of grievances filed each week. And just as a little stat on that, from October of last year to October of this year, we have had 3,337 professional responsibility concerns identified by our members. COVID also dramatically reinforced the imperative of occupational health and safety and our need also to enhance those resources as well. As we all know, the expression of the folk wisdom about living in interesting times carries the suggestion, interesting times are a curse, not a blessing. Leave it to you to decide. We have seen our government try to use the emergency created by the pandemic and the worldwide shortage of educated healthcare workers, especially nurses, as a crisis to be exploited in the service of privatization. And our former premier openly admitted that, in fact, the pandemic, COVID-19, unfortunately seriously interrupted plans for privatizing and outsourcing healthcare services. And today we are in the grip of a second crisis. And this is not a mysterious virus from across the sea. It is a crisis that has been created and is being made worse right here in Alberta. Brutal, another adjective, brutal understaffing, privatization schemes, and even contempt for the work we do. And now, as we are hoping that we are starting to recover from the pandemic, we have a new premier that apparently wants to throw our healthcare system back into chaos. Not to make things worse, not better, for reasons that are purely based on ideology. The staffing crisis that you are experiencing in your workplaces has been in the works for years. It is not caused by a virus, it is caused by ideology. It is the result of neglect, intentional underfunding, and harmful, dangerous staffing policies. And above all, it is a result of policies enacted by governments motivated by a rigid, market-driven philosophy that is fundamentally incompatible with fair and effective health care for all. And it is you who work on the front lines of our healthcare system who are asked to make the greatest sacrifices for that utopian dream. Because we know from the studies of economists, from the years of bitter experience, and there are still people here who remember the Klein years, from common sense, that privatization will never work. It will never produce the promised results. Yet you must continue to cope with short staffing, mandatory overtime, and exhaustion. It is your family members who face the fallout from this ongoing crisis, new crisis, or newly identified, or whatever you want to call it, especially among nurses. It's our family members who face the fallout from this ongoing crisis in healthcare staffing, especially among nurses, and that long preceded the pandemic. Your friendships, your health is what is affected. And it's why we have seen, or part of the explanation for why we are seeing in Canada's healthcare system a wave of retirements, resignation, nurses just walking away from their careers, all at a moment when society needs them more than ever in our modern history. Our leaders, including our leaders here and certainly political leaders, ask, who has the solutions? I can tell you who has the solutions, many of the solutions. We do. Registered nurses, registered psychiatric nurses, licensed practical nurses, front-line nurses. And it's time for governments, like Alberta's government, to listen to what we have to say. So what do we have to say to them? I'll tell you what we would say. Above all, priority number one, it's a simple requirement, that our elected leaders acknowledge there is a crisis, right? And that it's a worldwide crisis, but it is a crisis here. It can be made better by making it easier for nurses and other medical professions from abroad to get the credentials they need to work here when they come to Alberta. But it cannot be fixed by pretending we can solve our staffing problems in Alberta, which our own governments have created, by importing nurses holus bolus from other countries and relying on others to educate the professionals we need. Ravaging and raiding the third world for professionals is surely not how we should be solving our problems. So what can we do at home, quickly, that can help address the shortages? While the Alberta government might not like to hear this, But the crisis needs to be treated as a national priority with federal funds for education and upgrading. We need to expand nursing programs in Alberta to raise up a new generation of registered nurses, registered psychiatric nurses, and licensed practical nurses. What I've been calling, we need to grow our own, have our own ready supply. And we need to do and start that quickly. Tuition needs to reflect the need and not the desire of governments to underfund post-secondary education, just as they have underfunded public health care. To be clear, tuition for nursing students needs to cost less, much, much less, not more. Planning must reflect the reality that public health care does a better job than privatized health care, with its built-in need to finance profit margins. Why would you intentionally take $1 and spend it knowing that you're only getting 90 or 80 cents worth of value? It just does not make sense. It makes no sense to pay the private sector to do a job that public employees working in public facilities do better and do it for less. Oh, you're going to like the next part. Nurses' salaries. Yes, salaries need to reflect the market for nurses' skills. It's kind of ironic, right? Yeah. Isn't it ironic that market-driven governments that are always touting the benefits of the private sector don't want to acknowledge that shortages of nurses actually drive up nurses' salaries? Like, it's supply and demand, right? It's elementary, Dr. Dear Watson, right? If the supply is down and demand is up, you have to pay. Our governments have to face the fact that they have to pay nurses more in Alberta, or Alberta nurses are going to go away and work somewhere else. It's bizarre. It would have been funny if it hadn't been so tragic that our Alberta government went into our last round of collective bargaining just as the pandemic began, trying to squeeze wage rollbacks out of you. Like, really? Well, we proved we are strong together. And we will be back in negotiations soon. This fall, next fall. Oh, yeah, next fall. Next fall. It's going to be our provincial demand setting meeting. So for all our locals out there, 2023 is a year of preparing proposals and all that kind of stuff. And when we meet here next November, we'll be deciding what kind of mandate we're taking forward. And whatever government there is going to have to recognize that they're going to have to pay nurses what they're worth, right? I thought it always comes, this little voice comes from Margaret Etche, president who preceded me. And Margaret always said, you know, nobody wants to give nurses more money, really, right? But we're not sisters of charity. We deserve to be fairly paid in compensation for the value of our contributions to our society. Our government call low taxes the Alberta advantage, but a real Alberta advantage is the salaries paid to Alberta workers and professionals. Yes, salaries that are higher on average than other parts of Canada. Salaries that therefore encourage the best health professionals to come here. Trying to keep taxes low by underpaying nurses will have one simple consequence. It will drive nurses away. You are the healthcare professionals who will have the answers for what ails our healthcare system. And 2 weeks ago, Danielle and I, and Laura, this Canadian nursing students, and members of the CFNU board, including Pauline, I'm just naming people who are here in the room, we actually had a meeting face-to-face. We had a year or so ago, a year and a half ago, a virtual meeting with the Prime Minister of Canada, but we actually had a face-to-face meeting with Justin Trudeau and Minister of Health for Canada. And one of the comments I said to Mr. Trudeau was that, yes, our healthcare system is ill, but it is not terminal, even though some premiers may want to euthanize it. We do have the right prescriptions because we know there is a better way. We never met with Jason Kenney. We tried. And now we have a new premier. She has her own ideas about healthcare, some of which obviously we as an organization don't agree with, but she needs to listen to us. She has to listen to us. Maybe she will. Not there are consequences. As soon as she was sworn in, we requested an emergency meeting with Premier Danielle Smith. We told her that our priority was to improve workplace conditions so that we can deliver the high-quality health care that Albertans deserve and expect for themselves and their loved ones. We told her to endorse the Canadian Federation of Nurses Union's priorities for addressing the staffing crisis. Funding for programs backed by firm timelines with accountability to keep experienced nurses in their jobs, to bring nurses back to the public sector, and then to recruit nurses where they are needed most. Retain, return, recruit. It's totally offside, but PEI, I don't have the, Danielle, you might have the little text from Barb. PEI just this week announced that they're giving, let me see, big announcement for PEI today. 3,500 retention incentive for full-time RNs, prorated for part-time, $5,000 for those who are eligible to retire and agree to postpone it for 1 year, $3,000 for hard-to-recruit positions, mentorship programs to be announced later this week, and $8 million towards retention. It can be done better. We said we want lower nurse-patient ratios, increasing investments in more nursing seats in colleges and universities, and creating bridging programs and new mentorship initiatives. We need to have positions that people want to work in, not want to avoid. We need immediate and ongoing support for nurses' mental health. These are the solutions that can end, you wanted the magic solution to why people are waiting 16, 17, 20, 24 hours. You want a solution to end the day-long waits in Alberta hospitals. There are solutions. By contrast, privatization schemes that take doctors and nurses out of our public system are not the solution to anything, and they're certainly not going to reduce any wait times. I know we're all sick of talking about COVID, of living with COVID, but there is one more thing we need to say about the pandemic. We're not done with this disease. It may be with us for a very long time yet, maybe forever. New COVID variants continue to appear, and last week, and it's a huge bugaboo for me, the reduced reporting. Last week, the latest statistics said that there's still more than 1,000 people in hospital with COVID here in Alberta. Already, other provinces are talking about how they may need to return to policies to mitigate the spread of COVID and to protect the public. We here in Alberta, and the last update, have lost 4,951 Albertans to COVID. I suspect by the time the next one is posted, we will be over 5,000. That is equivalent to a town the size of Westlock or Didsbury, just gone. So this is certainly not the time to embark on a massive experiment and privatization based on ideology, or to restructure the provincial healthcare system with no idea what the results may be. And is certainly not the time to toss out the entire concept of public health. So you might ask, because I'm sure I've depressed you enough now, how can we feel hope when there is so much wrong in healthcare and so many challenges for our profession? In 1940, in the darkest days of World War II, Winston Churchill famously told Britons, "I have nothing to offer but blood, toil, tears, and sweat." And yet this was a message of hope. Because with a struggle comes victories. And only the struggle can there be victory. If you won't fight for something, it's hard to persuade anyone else it's worth fighting for. In Alberta today, we have hope because we know that public health care matters. We have faith that the people of Alberta can be persuaded that there is a better way than the constant chaos and crisis after crisis we have faced. We have confidence. We can persuade the Alberta government to listen to us. Might not be easy and it might not be immediate, but anyways, we do. I am confident. Evidence-informed decisions, right? We do have confidence that we can persuade the Alberta government to listen to us because, as you all know, nurses' voices are very powerful. We have WWW, and I actually got WWW from Ontario, but Wear White Wednesday. I have a new WWW. We will withstand. We will withstand because we are strong together. Thank you.